Hi, Brenda with the Hospice Care Plan, and let's discuss briefly transition into the active dying process. Um, I think this is the most difficult time. I think we would all agree. It's when people are feeling emotionally and physically that they're really losing grip on themselves and life around them. And it's the time that we see anxiety come to the surface more often. It's the time that we see injury due to falls happen more often. And it's when you're going to start seeing your hospice nurse more often. And this is when some routine medications are probably going to come into play for comfort, and you may stop those routine daily medications that you've taken for years. It's a tough time, and I think it's fair to compare it to the transition into birth. This is the transition into active dying. You're still up and about, kind of eating, but headed towards no longer eating, drinking, and waking up. And this is when you really got to rely on your hospice team to follow those regimens to keep somebody comfortable. You have to have full-time caregiving, whether it's family, friends, church, hired, where placement, but this is when they need a lot of attention. And is, I would say, the most difficult time. So I like people to read this before this happens, and then it's a bit more empowering when you see it coming and you can recognize it rather than we having to explain what's happening. And that's why this section, the transition of the hospice care plan booklet, is really good, because it's like, okay, this is what's happening, and it's less scary when you know what's happening. So please feel free to get a copy of our booklet at thehospicecareplan.com, or you can comment or ask questions on our YouTube site. We're happy to discuss that with you. Thank you.